So the first question for physiological reasoning: changes of pregnancy are less likely in regularly lactating mother. Now, to answer this question, you have to know what is a regularly lactating mother. So, how pregnancy is less likely in those scenarios? So, the answer, while you are attempting, you have to give physiological reasonings behind those answers. So, regularly lactating. So, these women are those women who exclusively or frequently breastfed their child. Okay, so physiologically it has been seen this ladies, that is regularly lactating ladies, it has been seen that physiologically there is suppression of some hormonal pathways okay, which are needed for ovulation. Okay, and we know ovulation is very important because when ovulation occurs, the ova is released, then through copulation the sperm comes, the joins and forms zygote. Okay, then later on due to developmental stages a baby is born, that is a pregnancy is happening. So if somehow this part of the step is obstructed in a regularly breastfed lady, okay, so the main reason, after many research, it has been seen that broadly there is two distinct reasons. The first is disruption of GnRH and LH release steps. Now, what is this GnRH and what is LH? GnRH is gonadotrophin releasing hormone, and LH is luteinizing hormone. Now these two hormones are released from hypothalamus and pituitary. Now these hormones are seen to be disrupted in regularly lactating ladies. The second is that there is a role of prolactin and oxytocin hormone. Okay, so these two steps has been seen physiologically present in a regularly lactating mother. Let's learn one by one. The first step, okay, this disruption of GnRH and LH. Now, what is these two hormones? For this, we have to know this chart. Okay, so there is a chart that you will get in textbooks. Okay, so this chart is basically showing you the importance of this hormone and this hormone. Okay, so there is an part of a brain. Okay, supposedly this is the cerebrum and this is the brain stem. Okay, if you make a cross sectional, so the very center, okay, you will get a tissue, brain tissue, which is called as the hypothalamus. Okay, now it's also called as your master organ of your brain or gland of your brain, so it releases many hormones. Okay, so one of those hormone is GnRH, or gonadotropin releasing hormone. Now this hormone is released whenever it is stimulated. It releases and it goes and stimulates the next part of the brain tissue, that is the anterior pituitary, specifically the anterior part of the pituitary gland. Now this anterior pituitary, it then, after stimulation, it secretes many hormones. Out of this, the luteinizing hormone and the follicular stimulating hormone are important in a lactating mother. Now it has been seen that FSH, that is follicular stimulating hormone, it is when released, it leads to stimulation of development of granulosa cells, which in turn leads to follicular development and leads to formation of ova, which is needed for ladies' regular menstrual cycle. On the other hand, luteinizing hormone is also an integral part of the cycle, because at the very middle part of the menstrual cycle, what happens, this luteinizing hormone helps in the secretion of the ova, okay, from the ovaries. So the ovaries are released approximately at the 14th day of the cycle, because the luteinizing hormone level in the blood is at peak. So what happens when there is regularly lactating mother, the suckling stimulus, the suckling, whenever there is the mother is been helping the baby to get the milk, okay, the suckling reflex, okay, the suckling reflex it stimulates the stimulus from this breastfeeding interrupts this normal pulsatile release of this particular hormone, okay, it will be inhibited, okay. So along with that, it is indirectly also been inhibiting the luteinizing hormone, also it is inhibiting this follicular stimulating hormone. So in this way, it is interrupting the follicular development or pregnancy. However, in some studies and researches, it has been seen that although the follicular is not fully inhibited, some of the follicles will lead to development of the follicles, but for the full maturity, it needs the help of luteinizing hormone also. Since this is not getting produced, so the follicles, even if secreted or is released in a less amount, it won't be affected, it won't be effective in full maturation or ovulation. Now the next part of our answer is role of prolactin and oxytocin hormone, okay. Now breastfeeding, whenever a lady is breastfeeding, okay, it raises the prolactin, okay. So let's abbreviate this hormone as PRL, okay. Now it has been seen this raised level of prolactin, it reduces again gonadotropin releasing hormone, okay, the hormone that we just now discussed, okay. Then this decreased secretion of gonadotropin releasing hormone in turn decreases the ovarian functions, okay. That means the luteinizing hormone is decreased, the follicular stimulating hormone is decreased, okay. So as a result of what happens, the estrogen levels are also decreased. Estrogen, since the follicles are not maturing, okay, so less amount of estrogen is produced, okay, and so it produces less ovulation, so no pregnancy, okay, happening. Another important point is that prolactin, this hormone, is also very important for milk production, okay, for milk production, and that's sufficient the need for baby, okay. Now oxytocin, what happens, oxytocin hormone in this aspect, it aids milk ejection, okay, because the epithelial lining are aided for secretion of milk. Now along with this, if you are getting in question the physiological reasoning about this question, and you are getting a marks of at least 5 marks is there, so writing this sufficient, these 2 points is not sufficient enough for getting the 4 marks. So what you can do, you can also write some added extra points, like this question also need to be answered in frequency and duration, okay. Just mere letting the baby suck the milk is not sufficient to prevent pregnancy, okay. So the frequency also matters, or the duration, means how many times and how long the suckling effect. Now the recent studies that has been conducted, it has been seen that suckling declines the pregnancy, okay, when it has been seen that the suckling is happening 5 times, approximately 5 times per day, okay. Or if you are considering as the duration, at least 65 minutes per day, okay. Now this is the study, so it has been seen, but study also showed that the exclusive breastfeeding offers approximately 98% protection to pregnancy, okay, during the first 6 months, okay, not after that. But despite this, the effectiveness decreases if feeds are sporadic, okay, or you are supplementing the feed with formula milks, okay, that means some artificial milks, okay.